Welcome to Exploring Awesome, the show where I explore tips, tricks, and strategies to help you and me to live a more awesome life. Today, I'm actually part of the episodes that I do are talking with other hypnotists because a lot of hypnotists have a lot of really great knowledge in different areas. And today, I'm greeted by really a good friend of mine. He's been on the show before. Today, we're going to be talking about hypnosis and dementia. So what you're going to learn today by watching. Now, if you're not sure what dementia is, we're going to explain what that is. Dr. Dan's also going to tell you why everyone really should be interested in this topic. You're especially going to be interested, of course, if you currently have someone who's suffering from dementia that you care about, or if you want to help those people. We're going to also talk about how hypnosis can help and maybe some other things that can help as well. We're going to let you know how to work with Dr. Dan if you need some help with this, and also how to learn this stuff. So without further ado, everybody please welcome Dr. Dan Nightingale. Yeah.
Hello.
I need to get a clap track or something so it won't just be me.
Yeah, that'll be a good idea.
Hey, Dr. Dan, can you tell us a little bit about yourself and your experience and maybe how you got into working with folks with dementia? Oh, before we do that, I just want you to know when I say Dr. Dan, I mean actual doctor. He actually has a doctorate, unlike some of these metaphysical doctorates that you might see some other folks in our industry have. Nothing against them, but this is from an accredited institution, so we really can use the term doctor. And the other part is too, when I did my TEDx talk, they needed someone to kind of sign off on the science that I was quoting, and they needed someone with credentials. And Dr. Dan had the credentials. He signed off on the research. Dr. Dan, please tell us a little bit about yourself.
And it was a good TEDx talk as well, by the way. I enjoyed
Why,
that.
thank you.
You did a good job.
Thank you.
Very impressed. Yeah, well, as you can tell from my accent, I don't come from the United States, where I actually live now. I'm a Brit. I did the majority of my training in the UK. I trained originally as a social worker, and then I trained as an RN, and I worked for the National Health Service in the UK, and they funded me to do my doctorate. So I worked in Bristol and Scotland, and I got my doctorate, and was also awarded a recognition for my work in dementia by the University of Stirling, which is the world's leading university in dementia. So after I'd done all the hypnosis stuff, I was awarded recognized as being one of the persons that made a massive contribution to the field of dementia. So that was a cool thing as well. I'm trained as a clinical hypnopsychotherapist as well. I trained with the National College of Hypnosis and Psychotherapy in the UK. So I've done that. So yeah, I'm a clinical dementia specialist. My office is based in Tempe in Arizona, but I work around the world with other people. I've got patients and clients in the UK who I work with via telemed. So that's pretty much me. There's a lot. There's a lot of stuff that I do, and I do research, I do education. I'm an author. I do all kinds of stuff. But my passion is dementia. It's been my passion for 20 plus years, and I know I've made an impact globally, so that's brilliant, because that really impacts on people who are living with dementia, which of course is a journey that everybody in the world is experiencing.
Yeah, and I want to hear more about that in just a second. If you're watching live now, we're actually recording this about 10:35 on Sunday, November 15, 2020. If you're watching live, you see Laura said welcome. Thanks, Laura. If you're watching live, feel free to drop your questions down below, and I will try to get to those. Dr. Dan, so you said when we were talking earlier, you said that over 50 million people in the world are currently living with dementia.
Right. Yeah, that's approximately 50 million people worldwide have been diagnosed with dementia. Think about it this way: every 3 seconds, somebody somewhere in the world is diagnosed with a form of dementia. Every 3 seconds.
Wow.
It affects children, it affects younger people, and it affects seniors as well. So it's not just a disease that impacts on older people. We are seeing more and more younger people between the ages of 40 and 50, working age, who are presenting with a form of dementia. So statistically, it is a global challenge financially for health services, and also, of course, emotionally, psychologically, and physically for people who are living with the disease and their families and people who are supporting them along that journey.
Wow, my ears just perked up, Dr. Dan. You know, I think a lot of us tend to think of our grandparents, you know, maybe our parents as we get older. But you said between 40 and 50. What's up with any ideas on why people are getting this earlier?
Yeah, so let's just talk about the basics of dementia to start with. Dementia is an umbrella term that means a set of symptoms. So dementia itself doesn't really mean anything. It's like I've got a chest infection. So what is causing my chest infection? I have dementia. So what is causing my dementia? And the main form of dementia is Alzheimer's disease, which affects probably around about between 70 and 80% of everyone living with dementia, with a diagnosis of dementia, has Alzheimer's disease. There's over 100 different types of dementia, some that affect children, some that affect the younger people. If you're 40 to 50, there's around about 44,000 people in the United States who have young onset dementia. And it's usually a mix. We often think about Alzheimer's disease, but very rarely does Alzheimer's disease work on its own. There's usually a collaboration between Alzheimer's disease and vascular dementia, which is the second most common type of dementia that we see. So this brings me back to your question about your initial question about why we're seeing 40 and 50-year-olds.
Yeah.
Diet and lifestyle has the biggest impact on young onset dementia.
Wow.
Sugar has a massive impact on dementia. Diabetes is sometimes referred to in the profession, not widely or academically, but within the profession, we often view diabetes as Alzheimer's type 3 because, you know, diabetes type 3, is Alzheimer's disease.
Yeah.
You know, so because of the link between the sugar and the insulin uptake in the brain and the impact that it has. We need sugar, of course. The brain needs sugar. It needs a certain amount of sugar. But people are throwing sugar into their bodies left, right, and center. Soda.
Yeah.
And just food in general. You know, everything in America has fructose, has corn syrup in it.
Right.
And it's a killer. Sugar is poison. It's a killer. So there's a massive link between obesity, diabetes, and dementia. Heart disease, of course. The vascular dementia is caused by tiny little strokes in the brain. So that's vascular dementia. And if people have 2 or 3 tiny little strokes, they might be okay. Have some more, and you're going to start developing the symptoms of dementia. Same as Alzheimer's disease. The symptoms are very similar to Alzheimer's disease. So that's why we're seeing younger people presenting with it. And we also are seeing neurocognitive disorders in people post-COVID. So some of the people, you know, post-COVID, the disease has gone away, but they're left with some neurological damage somewhere along the line. So I think over the years, we're going to see an increase in cognitive impairment because of this silly COVID virus, which is why it's absolutely crucial that people follow the science and mask up and wash their hands and social distance. So
and you know, I think it's and like you said, I mean, the actual science, not just some guy who has a YouTube channel that has a friend who has a neighbor who happens to be a nurse or something. You know, it's so frustrating. The other thing too, I think, is a lot of people are out there, well, you're probably not going to die from it. I mean, most of us probably, we get it. We're going to suffer a lot, but we're finding out so many things about afterwards. And that's what kind of made me perk up and go, oh, maybe I do need to be concerned. I probably beat it the first time. I think my odds are pretty good, but what's going to happen down the road?
Yeah, absolutely. Exactly. So we do need to take those precautions. We do need to follow the science and just be very, very vigilant. We're seeing the numbers raising again all around. And the UK, well, England, not the UK, but England are back on lockdown.
Mm-hmm.
They're on lockdown until mid-December now. So we're seeing. I
think our governor here in Washington is about ready to announce, I think, a lockdown for us too. Right. And it makes sense, and I know it's terrible. I'm not able to do the work that some of the work that I love to do. Being on stage, but it's so important that we protect ourselves.
Some will say that's a blessing, Jim, but
Well done. For those of you that don't know, Dr. Dan also went to the Patch Adams School of I don't know what you call it, but comedy with medicine.
Comedy and clowning and healing. Yeah.
Right. Comedy and clowning and healing. So he thinks he's a funny guy. That was a courtesy laugh. That wasn't a guffaw. I want to say too about the sugar thing. It's interesting. My mom, as many of you, if you know me, my mom was suffering with this for quite some time, and didn't get diagnosed. A lot of people out there, when they start noticing this, they're in that kind of denial. They don't want to. She didn't want to know. And I was like, Mom, you got to find out, because there might be treatment, And I think the really frustrating thing, and then I want to get your idea on this. I had some family members that were sort of just like, well, she's getting old. That's just the way it goes. And so they weren't kind of encouraging her to go to the doctor. And I was like, we don't know. We don't even know exactly what's going on. So how can we possibly know if there isn't some kind of treatment? So could you address that? If somebody's out there and they're either them or a loved one is starting to go through some of the symptoms, and maybe you can tell us a little bit about that, what should they do?
Yeah, absolutely. The first things that you're going to see, and we've got Thanksgiving coming up. Mm-hmm. So we've got this major holiday where families get together and they may not have seen each other for quite some time. So be really vigilant, especially if you're going to see your older parents and relatives and stuff. Be extra vigilant. Look out for little telltale signs of people repeating the same story over and over again. People making these little mistakes, like getting mixed up with words, or getting mixed up with a little task that they're used to doing, like making a sandwich, or cooking a turkey, or those kind of things that people are used to doing and that they've been doing for a long time. Be extra vigilant and notice those things, and notice if anybody's having problems getting lost and not being able to find their way around even their own home and things like that. There are subtle signs, and this is the time when we really need to act immediately. Mm-hmm. And a little task, a little thing that people can do with their relatives is a clock test. It's one of the biggest things that we do as clinicians to screen somebody. We'll ask them to draw a clock, put the numbers on, and put the time at 10 minutes past 11, for example. Mm-hmm. And because we're seeing people at Thanksgiving and getting together as families, we can kind of make it a little game, a family game, so that we're not stigmatizing somebody and saying, making them think they're stupid or whatever it is. You can include it as a game. Same at Christmas, introduce it as a little game, because the clock test really does give you a clear clue that something is not quite right cognitively, and that is the time. The sooner the better. We can get people to see their doctor, primary physician, neurologist, get a full screening test done, and then of course there are some medications that can be prescribed that are cognitive enhancers that are geared towards slowing down the progression of the disease. They don't work for everybody, and they only have a very short-term span. And what they do really is just improve cognition, And it doesn't really address the other challenges that people are having, which we can talk about in a minute, but it certainly helps with slowing down the cognitive challenges that people living with dementia experience on a day-to-day basis. So be extra vigilant over the Christmas time. It's a perfect time to keep your eyes open and check and spot if any changes with your family members.
I drew the clock.
Beautiful.
Did I pass?
Yeah, I think you need to make an appointment with me. I do telemedicine, so it'll be all right.
Good. You know, if you're out there, I mean, hey, it's do the clock test, find out. One thing I'd like to add, and you can maybe comment on this, or maybe I disagree, I don't know, but my mom, when I first told her that I thought she needed, and it was hard to have that conversation to say, I think you need to just talk to your doctor, just ask about, there's some things that are going on that are a little bit odd. And she talked to the doctor. The doctor did, that sort of thing that and I don't know if it involves a clock test, but they ask a few questions, that initial screening thing. And my mom passed that. And she said, no, I'm fine. And I said, you know what? I understand you passed that, but would you ask them to refer you to a specialist? Because that was not enough. Because there was something going on, but she passed that test. Can you comment on that?
Yeah. That's a screening test, and she probably did something called a MOCA, which is a Montreal Cognitive Assessment Test, or a SLUMS, which is a St. Louis Assessment Test. And you can score up to 30 points, and if you score between 27 and 30, you're in the normal range. However, what an experienced specialist clinician like myself and the guys over at Barrow Neurological Institute will spot are other things, other clues. So you might be able to fly through that screening test. And so if you go and see a primary physician and they pass that, then he'll say, that's okay, you're fine. What we're able to do is spot other things, spot little clues, those things that I just mentioned earlier, for example. And so it's always advisable to go and see a specialist. I work in conjunction with Barrow Neurological Institute here in Phoenix. So, that's the place to go. People go from all around the US there because it's the most famous place, and it's, got the most innovative treatments and therapies. And they believe in referring patients to me for hypnotherapy. So the neurologists and the neuropsychs over there send patients to me for hypnotherapy for managing some of their stuff. So somewhere like Barrow is the place to go. So yeah, those screening tests are just a screening test. It takes maybe 10 minutes or so. I use it in my practice with patients, but I'm also looking for other things as well.
Yeah, that was just really frustrating, because I could tell just by talking to her on the phone that things were not right. And the doctor's like, oh, you're fine. And no, you really, and she didn't go see a specialist. And then it just deteriorated and all that. But anyway, I don't want to.
The thing to get, this is the challenge, because people will be very, very resistant, because the word dementia is scary for people.
Yeah.
But the good thing is now, 2020, we have a lot that we can do to help people. It's not a death sentence anymore. It's not all doom and gloom. And, if people can acknowledge that it's not part of the normal aging process, we shouldn't get dementia. Most of the time, it's avoidable, or at least we can reduce the risks of developing it. So I think we have to stop them. It's the way we say it, and the education out there. There needs to be more education about the fact that, it's not as scary as it used to be. When I started my training, we used to use the C word around patients who had cancer. We might tell the relatives, but we might not tell the patient that they've got cancer.
Wow.
And we'll use the C word.
Wow.
And because people were terrified and petrified. You mentioned cancer, and it's so scary. And it is a scary disease, but we know there's so many things we can do to treat cancer now and to make it go away. But we've also you know, the knowledge about how you reduce your risks of getting cancer, how you reduce your risks of heart disease, how you reduce your risks of stroke, your risks of developing dementia. It's all about education around diet and nutrition and lifestyle.
So when you say diet, nutrition, and lifestyle, you're talking about, it sounds like maybe you're saying cut back on the processed sugar. Are you talking about some exercise? What kind of things can people, what maybe 3 things people could do to help to avoid or slow down or even maybe reverse this?
Three really simple things that I suggest to people. And every patient that comes onto my list, these 3 things we do. 20 to 30 minutes of adult colouring every day. And that's, you know, lots of people are doing that now, and a lot of people are working from home. So
yeah,
take 30 minutes or so out of your stressful day and do some adult colouring. It does a lot of things, does that. It works on your pincer grip. It has hand-eye coordination. You have to concentrate. You have to focus. So you're waking up different parts of the brain as well. So adult colouring is one of the first things that people need to take up. Secondly, walking. Make sure you have a walk every day.
Okay.
Half an hour or whatever. A lot of people have got a dog. Take the dog. Go and have yourself a walk. And weight training. Basic weight training.
Okay.
Just little weights, 2 pounds, 3 pounds, or whatever. Doesn't matter. Just get some weight training. There's some research came out of Japan that demonstrated that all those things, those 3 things combined, can arrest the part of the brain called the hippocampus, which is responsible for memory. Or one of its responsibilities is memory. And from the age of 40 onwards, it shrinks by 0.5% every year. And this is why, as we're getting older, we kind of start struggling to grab memories and recall. Right. So by exercising the hippocampus, we can change that. We can arrest the shrinkage. And in some MRI scans, it showed that the hippocampus started to grow again.
Wow.
So really basic things that people can do. And of course, the brain is an organ. The brain is a muscle. It needs to be exercised every single day.
Yes.
So keep learning something new. Keep your brain active. It's very lazy, the brain. It'd go to sleep. If it could, it'd just sleep all day long. So change things around about it. Do jigsaw puzzles. Do puzzle books, word search, and trivia, and things like that. And if I'm right-handed. So for 5 minutes every day, use your left hand. Practice writing your name with your left hand. Practice using your computer with your left hand. Because what you're doing, you're firing different neurons in the brain and exercising a part of the brain that is normally asleep. So really simple, basic things. You know, you don't have to get into luminosity, and you don't have to subscribe to these expensive things. They're all there around you. Everyday items in your house are there that you can use to exercise and, you know, read. People have stopped reading now. People don't read books anymore. So read a book.
Read a book.
Yeah.
You know, it's funny. I was a while back. I was teaching a class on how to use iPhones or how to use smartphones. I was teaching older adults how to use smartphones, and I told them, every time you get frustrated, be thankful, because that means you're using your mind and you're learning something. And so even though it really sucks, it hurts, it's painful, you're doing something good for your brain. So keep it up.
Absolutely. Yeah. And because of the COVID, one of the positives of COVID is that older people are having to get used to telemedicine. So they're having to get used to a different technology. They're having to learn how to use an iPhone. They're having to learn how to use a computer and learn how to interact and communicate with the doctor via telemedicine. So that's a good thing, because that, again, you're using a different part of the brain. Because older people have always been resistant to technology. When we've tried to introduce telemedicine for a number of years, Telemedicine to me makes so much sense because you don't have to go out in the, especially if you live in England, you don't have to go out in the pouring rain and the freezing cold and the snow and the wind. And in Seattle, the same thing. In New York, the same thing. So it makes sense. And what Barrow did was took advantage and built their telemedicine platform and said, right, because of COVID, it's telemedicine. So a lot of the people are having to they're being forced into learning a new skill, and that's brilliant because, even though you have dementia, you can still lay down new neuronal pathways in the brain, which means you're learning new skills or relearning some of the skills that you've lost. So it's COVID has had some advantages. I'm trying to find positives from COVID. That's
reframing. Reframing.
Yeah.
So,
reframing.
So I want to let everybody know, especially those of you that are going to listen to this later. We're filming it live, so you can watch on YouTube and Facebook and stuff, but and even LinkedIn now. But if you're listening to this later, if you want to get a hold of Dr. Nightingale, it's NightingaleDementiaConsultants.com. And don't make the mistake that I always make. His name is spelled Nightingale. It's NIGHTINGAL. DementiaConsultants.com. You'll find that in the notes. Dr. Dan.
You forgot the E on the end.
Did I? Ah, dang it.
L-E.
How about you tell them your website?
Yeah, Dr. Daniel Nightingale with an E on the end. NightingaleDementiaConsultants.com is the website, or Dr. Daniel Nightingale.com. See, I don't even know. Yeah.
Dr. Dan's going to make an appointment for himself and me for his treatment.
Yeah.
Dr. Dan, how in the world, because there's a lot of people out there that don't know anything about hypnosis, or they think it's BS, or it's some kind of mystical, do you have to be a psychic to be a hypnotist? I get this question. I don't know where that comes from, but there's a lot of people with a lot of ideas about hypnosis. Can you tell people how in the world can hypnosis help somebody with dementia?
Yeah, well, as you know, Jim, hypnosis is normal part of the day. It's not magical. There's nothing psychic about it. There's nothing woo-woo about it. Hypnotherapy is something hypnosis is something that we experience throughout the day. Maybe every 90 minutes we go through this cycle of daydreaming or driving from A to B and getting to B and thinking, wow, I don't remember getting to this part. Highway hypnosis. It's a normal part of day-to-day activity. So when we talk about hypnotherapy, we're talking about a deep, relaxed state. That's it. Deep relaxation. A state that we can go into ourselves. We teach self-hypnosis for that very reason. So it isn't woo-woo. But what it does is we've got a conscious mind, and I'll link all this into how it works with dementia. We've got a conscious mind that Jim and I are using right now, that everybody who's watching and listening to this are using the conscious mind. But it only accounts for between 5 and 10% of all our thoughts and memories and behaviors and actions. Sitting behind our conscious mind is our subconscious mind, where the majority of our life experiences, memories, belief systems, they live in there. We don't access them all the time. Or if we do, we access them on a subconscious level. We don't really know that we're accessing them. So what we do as hypnotherapists, clinical hypnotherapists, we open that door, that dividing door that separates the conscious and from the subconscious mind. And once we do that, sitting on top of that is a little guy that we call the critical factor, or a hidden observer. And he's watching everything we're doing. And if Jim or I or another hypnotherapist has you in a deep stated route of relaxation, and we're talking to your subconscious mind, and for some reason you feel uncomfortable or something happens, the hidden observer says, we're going to stop now. The doors will close and you'll come out of hypnosis. So despite what people think, clinical hypnotherapy is very, very safe. very safe. The recipient is always in control. And sometimes you're flitting in and out of conscious awareness. And sometimes you're thinking, you know what, I could just get up and walk out of the room. Mm-hmm. So, you know, the person is always in control. You're always in control. It's very safe. Jim is very experienced in both stage hypnosis and as a clinical hypnotherapist as well. So, you know, he's got a lot more knowledge and experience than I have, certainly of the stage hypnosis, because I don't do it. I've never trained in that. But all the things that we do are very, very safe. And if you're able to watch Jim's X Factor, if you're able to watch Jim's TEDx talk, please go and do it. I think you'll find it on YouTube. It's worth watching. I recommend everybody watches it, because you'll get an understanding there of how hypnotherapy works and how you interact with the hypnotherapist and the client, the patient. So always look, always research it. Research the stuff. So hypnotherapy, I'm just looking at my why. Can
I just go ahead.
I was just going to run it. I was just going to segue into hypnosis and dementia. Yeah, is that okay? Yeah. So a number of years ago, I was one of the first, if not the first, dementia doctor appointed in the UK. And my responsibility was to look after the dementia care needs of 200 at that time, 200 nursing and residential care homes in England, Scotland, Northern Ireland, and Wales. Over the few years, that grew to 800. So I had this responsibility for 800 places.
Wow.
And we were looking for something that we could use to help treat dementia without relying on medication. Antipsychotic medication, neuroleptic medicines, were being given like sweets to people who have the behavioral and psychological symptoms of dementia. An antipsychotic, there's the clue in the title of that medicine. It's to treat psychosis, not dementia symptoms. But that's what was happening around the world. And so if people were aggressive in a nursing home, they would give them medication to calm them down, to quieten them down. And it was wrong. And we did some research with King's College in London and discovered that, you know what we're doing with these medicines? We're cutting the life of people living with dementia. They were dying quicker than what they should. So we started to research this, and I worked with the government in the UK and at Westminster. And of course, most people will know that Boris Johnson is the Prime Minister of the UK now. At the time, he was the Mayor of London. And I used to bump into him quite a bit down at the Houses of Parliament. And the guy's as nutty as a fruitcake. I'll just put that out there. And so we had an investigation into the overprescribing of antipsychotic medicines to people who were living with dementia, mainly in nursing and residential homes. And we came out with a document called Always a Last Resort, which meant that we only give those medications as a very, very last resort, and we try everything else first. Well, what is everything else first? What does that mean? You know, what have we got in the toolbox? Well, there was nothing, Jim. There was nothing. You know, they didn't retrain the nurses and the doctors. Nobody knew what to do. So what I did as with my responsibility in the UK, I was looking around for something that we could introduce. And I looked at a few different things, but I saw this course for hypnopsychotherapy with the National College of Hypnosis and Psychotherapy. And I thought, I wonder if hypnosis would work with people who are living with Alzheimer's disease and other types of dementia. They funded me, and my healthcare provider funded me to do the training. So cutting a long story short, it was 4 years in total that we did our training over a 4-year period. I met a forensic psychologist called Dr. Simon Duff, and we became really close friends, and decided when we had to do a piece of empirical research for our training, we decided we would do it using hypnosis in dementia. He was based at the University of Liverpool then, so he had the support from them. And I was obviously, looking after all these homes. So I had access to patients and nursing homes and residential homes to enroll patients into the research. So that's how that came about. And I had no idea what was going to happen. I had no clue, because nobody's ever done it before in the world. It was a first. So what we did was it was a small study, and some people who criticize this always say, oh, it was a very small study, but nobody else has come along and replicated it. So shut up. If you want to come and replicate it, I'll support you to do it. Otherwise, be quiet. Don't criticize it. Yeah. So we had 18 people in total. There were 6 patients who received hypnosis 1 hour a week for 9 months from me. I was doing the clinical bit. We had a neutral group who was treatment as usual. Nothing changed over that 9-month period. And we had a control group who attended a weekly discussion group. So they would pick a topic in the news, whatever was the main thing, and they would discuss it. There were 3 people who knew who was in which study, and that was myself. I only knew the patients receiving hypnotherapy, by the way. I didn't know who the other 6 were in the other groups. The two managers, the manager that ran the nursing home and the manager that ran the residential home, they knew which people were in what group. That was it. Nobody else. So all the nursing staff every day had to complete a form, which was based on a Likert scale, which was 1 to 7, identifying what changes there were in that person's day, if any, in relation to things like relaxation, memory, motivation, socialization, communication, those kind of things. I would collect the information every 3 months and take it to the university, give it to Duff, and he would do the data, the scientific data, because he's the brains behind the outfit. I'm just the handsome beef. He's the brains.
Obviously. Yeah, obviously.
So we did that 3 months. At 6 months, we thought this is really interesting, because we're seeing some fantastic things happening. And then at 9 months, when it was all collated and we compared the hypnosis group to the neutral and the treatment as usual group, the control group, every 7 key things that we identified on the Likert scale improved. They all improved. The others, not so much. A little bit of improvement and then a drop off. The others kept going up and up and up.
Wow.
And there were 7 key areas, which included memory for significant events and socialization. Yeah. There are 2 very important things for people who have dementia. Socialization, because one of the first things people start to do when they start realizing that there's something wrong is withdrawing to themselves, which then leads to depression. So we'll often diagnose depression and miss the dementia because of that. And the second thing is, of course, the memory for significant events, immediate memory. The other things were ability to relax, socialization, communication, and a couple of other things. So we thought, wow, that was not expected. Didn't expect that at all. And the progression of the disease had slowed down, which was incredible. And for the first time ever in my clinical life, I saw a 78-year-old guy with Parkinson's disease whose tremors were so bad he couldn't drink a cup of tea out of an ordinary cup. He had to use a tippy cup, like a baby cup. And it really upset him. He hated it. I bet. And he would fling it across the room. He would get so upset. I can't remember now whether it was the 3rd or the 4th session of hypnotherapy. And in hypnosis, the tremble, the shakes, the tremors go away. We know that,
Wow.
We know that. That's not unusual. What is unusual is that post-hypnosis, he was able to drink a cup of tea out of a proper cup. And just imagine the impact that had on him as an individual, and on his pride and confidence, and on, people with Parkinson's disease struggle with a facial expression. They're very, very serious, you know. However, you could see him smiling. You could see how impactful that was. That little tiny thing of being able to drink. There was still some tremor, but he could drink his tea out of a mug, a proper cup. So, and that was fantastic. And that was one of the 6 that were in that research group. So we had this published in something called the Journal of Clinical Hypnosis. And as part of the hypnotherapy, I trained self-hypnosis to the caregivers and to the actual recipient of hypnotherapy. So they had that skill because I saw them once a week, and I insisted that throughout the course of the week, when I'm not there, we must do this 5 or 10 minute self-hypnosis exercise. So that was that, and that was brilliant. So I thought, right, excellent. Now I'll start teaching some little exercises to doctors and nurses within my team who could use that with their patients rather than using medication. 12 months later, Duff, we were having a cup of tea, and Duff said, I wonder what that group of hypnotherapy patients, I wonder where they're at. I wonder if it's still beneficial. So he said, let's do a longitudinal study. So we said, okay, let's do that. So we went back and we did this longitudinal study, which basically means we were looking at, was there still some impact? Was it still beneficial? And it was.
Wow.
It blew us away, the fact that 12 months post-hypnosis, because the hypnosis had stopped, they weren't getting any more. 12 months post-treatment, we were still seeing the benefits of the hypnotherapy.
Yeah. Wow.
So that was published also in the the European Journal of Clinical Hypnosis. They published a longitudinal study as well. And that's kind of what grabbed the world. That's what made me a pioneer in the use of hypnotherapy in dementia, because of those empirical studies and publications. And then a journal in America, an Alzheimer's Care Today journal here in America, picked it up, and they also published the work, which is why I ended up here 8-9 years ago because of that. So to kind of summarize all that, hypnotherapy for people living with dementia is positive, it is impactful, it improves quality of life, and in some cases it slows down the progression of the disease. Now, if that's not fantastic, all without side effects.
Right, yeah.
And all without having to spend thousands and thousands and millions of dollars on pharmacological research. So if that isn't valuable to people who are living with dementia and their caregivers and family, there's something wrong with the world somewhere. So I use it in clinical practice and have done so for many, many years. And as I said now, I have a thriving practice here in Tempe, which in part is because the neuro team at Barrow have seen the research, they've seen the outcomes of my work with the patients that come from over there, and so now they kind of refer on a regular basis, usually for hypnotherapy, to treat things like depression, anxiety, and fear. Because the two things that fuel the symptoms of dementia, and this is the magic, the two fuels that feed into the symptoms of dementia are fear and anxiety. Once we manage to remove the fear and anxiety as much as we possibly can, or put it where it belongs, which is down in, where we need it, if we need to grab it, because we all need it. We need fear and anxiety to survive. We can't make it go away, otherwise we're in trouble. Yeah. But you and I know if we need fear and anxiety, we can access it. With people who are living with dementia, it's every single day. Every day. You wake up in the morning in an unfamiliar place. You might wake up next to somebody you've been married to for 60 years and have no clue who it is.
Yeah.
Or their name. So you live in this perpetual state of fear. And of course, you're very, very anxious. So your day you have a really bad day and your dementia progresses. So if you can manage that and hopefully dissolve it as much as you can and put the person back in control of their world, like we did with the guy with the cup, with the drink, and put them in control of it and let them see how they can control their world and how they can control fear and anxiety, then you've put them in a really, really good, powerful place. And you've turned a frown into a smile, and you've had a massive impact.
Incredible.
What we need to see, Jim, is more and more clinical hypnotherapists or registered hypnotherapists learning how to, because it's very complex working with people who are living with dementia. It's not an easy thing to do. More and more hypnotherapists, they can have such a massive impact if they learn how to work with people who are living with dementia. Their practice can thrive. They can grow their practice massively as well by having those skills and those competencies. And I encourage clinicians to take it on, to have a go at the training. And people who do my training, I've got a diploma which is now accredited by the American Council of Hypnotist Examiners, AIC. They've accredited the program for CEUs. It is an 8-month diploma program. It needs commitment because they have to, people who do the course have to complete an assignment every month, and there's other things that they need to do. But once they graduate, and there are 8 people due to graduate from that diploma the first 2 weeks of December, they go on to what's called a mentorship program. And the mentorship program gives them lots and lots of support once they graduate. They have marketing support, they have clinical support, they have opportunities. So that, for example, I have a flyer that I send out to Barrow Neurological Institute. They have that with my details on it.
Yeah.
In the January flyer, it will have all the people who are on our mentorship program, because now they are NDCs, they're Nightingale Dementia Consultants. Because Barrow have got people coming from all over the US, and I can't see everyone. So that's going to help them as well with those guys. So there should be from January onwards, there should be 14 Nightingale Dementia Consultants in the US, the UK, Australia, and Spain. So we're growing in number, and we're having an impact. And you just think about those numbers that we talked about before, Jim, about 50 million people currently in the world. Children, 1 in 100,000 in Australia, and 1 in 150,000 elsewhere. I don't know why Australia's different with their prevalence rates. But 1 in 100,000 children in Australia develop a form of dementia. They're born with it.
Wow.
By the age of 10 or thereabouts, that's when they present with the disease, which is very similar to Alzheimer's disease. Niemann-Pick's type C is a type of dementia for children. So there are children to be worked with. There are the young guys that we talked about who, again, have a different challenge. People in the 40s and 50s have got different challenges to the retired people or those in their 70s, 80s, and 90s. The challenges are different because they may still have kids at home, or they may have kids in university. They may still have a mortgage, so they've still got financial responsibilities. So the impact is a little bit different for those than the people who are older. So there's lots of different things to learn about dementia and how it impacts on the individual and on their quality of life. So there's lots we can do. There's lots and lots of people out there who are struggling, who don't know that this service exists. There are people out there that have no clue that hypnotherapy is available to people who are living with a form of dementia. So the more we can get the word out, the better. Because at the end of the day, we all want to make a difference, and we all want to help those guys out there. And it's you often hear this thing where they'll say it takes a village. Well, with dementia, it really does take a village to support somebody to enjoy a quality of life and to embrace their dementia. If on the Nightingale Dementia Consultants website on the homepage, people can see some of my patients talking about the impact that it's had for them. And there's one guy who's called David, and he wants to be my poster child, because when he was referred to me from Barrow, he was really struggling cognitively. Post-program, and now I just see him once a month, but I was seeing him every week for quite a while, but now it's just once a month. And his scores on the cognitive function tests over at Barrow, which are a 4-hour neuropsych testing, they've increased. And they're like, wow, they've increased. And when I do his cognitive assessments, when I see him, he's up there in the normal range. And I've got a couple of people like that, but one of them is talking about it on the website. So
that's awesome.
It's
what?
Very impactful.
Absolutely. And I love that you talk about research, because I still will do a consultation with someone and they say, I just wish there was more research about this. And I'm like, there's scores. I mean, and it's not just some guy in a basement. I mean, these are major universities and major publications that are I don't know how we're doing a terrible job about getting the information out. That's
absolutely
what I do.
There's always this. You see, education is one of my passions because we can, and this happened to me when I qualified, when I was put in the position of being the UK's first dementia doctor. It was like, okay, I've had all this education. If I hadn't had a nursing degree,
right,
I would have no clue how to have put that academic stuff into practice, because there was no bridge gapping. There was no bridge to close the gap between academic ability and clinical practice. Absolutely crucial. And that's why when I talked about the diploma, there is that bridge between, okay, you've done all this academical work and you've learned all this, and now how do I put it into practice? Well, here's your support, here's your guidance, here's all the tools and all that kind of stuff. So you're absolutely right. Why there isn't more and more education that bridges the gap between academia and clinical is crazy. Because, there are some people out there that learn hypnotherapy, for example, and then they go out and they say, right, I'm a clinical hypnotherapist now. What?
Right.
You've not even seen a human being.
Right.
And so I think people who are grounded, and then there's people out there like Roger Moore who is very experienced, he's been around a while, and Beryl Comer, who's been around a while, and Catherine Zinnerman, Catherine Zinnerman. Those people, they know what they're doing. They've got little bags and bags of experience, and they're also educators as well. They're educators as well as clinicians, and that is a secret ingredient to being able to provide a really good quality service, being able to bridge that gap between education and clinical practice. So I think you've got a really good point there. And Duff and I have been waiting for years for somebody to come along and say, you know what, we're going to do that research, because we can't do it again because we'd be biased. So, I could act as a consultant for somebody who wants to do the research, but it needs to be somebody out there that says, right, let's replicate the Nightingale Duff research and see what comes out of it.
Well, and if I could say, one of the problems that we have in some of these the more natural approaches, because hypnosis is perfectly natural, like Dr. Dan explained earlier, is there isn't this like, take for instance some if you're looking at like a pharmaceutical company, right? They have a lot of money to be made if the research shows that it works for them. And I'm not even going to talk about whether it's legitimate or not, but if the research shows that they can make a lot of money. Dr. Dan and Dr. Duff, they can't invest that kind of money. They're not going to see that kind of return. We don't have a huge organization that can invest the kind of money that would be necessary for some of these long-term, really robust studies. And so unfortunately, we're kind of stuck with what we've got, but we do have, Stanford has done amazing research. It's a university right here in the US that's very well known. So there is a lot of research, but we do have some challenges there.
Absolutely, we do have some challenges. And one of the things that Dr. never remember her name, Florida, Mary Newport. Dr. Mary Newport, a few years ago, she's retired now. She was a neonate specialist over in Florida, and her husband was the manager of the practice, and he developed Alzheimer's disease. So he went through the usual protocols and was prescribed donepezil, which is usually the first thing that is given to somebody who has early onset Alzheimer's disease. And it didn't work. It had a really bad effect on him. So she took him off it and she gave him coconut oil. And within a very short space of time, his symptoms had reversed to such a degree that he was back at work.
Wow.
He went back to work, doing the finances, the accounts, the bookkeeping, and all that kind of stuff. So Mary Newport is a name for people to remember and research, because she's demonstrated through her own work that MCT, coconut oil, medium chain triglycerides, have a massive impact on your brain by shutting off one of the receptors that causes memory loss.
Wow.
That leads. So have a look at that. Check that. Look into Mary Newport, because she's out there and she's doing some sterling. You'll find her on Facebook. She's doing some sterling work. But she tried to get pharmaceutical company to research the benefits of coconut oil. And of course, what did they say? No, mate. There ain't no money in that for me, mate.
They can't put a patent on coconut oil. So
exactly. So what did happen was the University of Southern Florida, they were doing the research. They had 46 patients. 23 had Alzheimer's, 23 didn't have a diagnosis of Alzheimer's disease. So that happened a number of years ago. And then crickets. Crickets. Nothing. We've not heard anything out about that research. So it was probably closed down by somebody. So absolutely, this is the thing about pharmaceutical companies. They're in it to make money, aren't they? They're going to make
ultimately,
the vaccine for COVID. They're going to be, once that's done, they're, money.
Okay.
Yeah. So another place, Jim, that people can learn about the research other than in the journals that it was published in is in chapter 3 of this book, which is a clinician's guide to non-pharmacological dementia therapies. The research is in here. So people can get that on Amazon, published by Jessica Kingsley Publishers. It was a commissioned book, not a self-published book, so I don't have inventory or anything. They've got to get it off Amazon or Barnes & Noble, or if you're in the UK, Waterstones or other good bookstores, that's where they can find that. And there's some other good stuff in there about, how we use CBT, NLP, and lots of models and lots of ways of working with people who are living with a form of dementia. So it's not just for clinicians. Don't be put off by the title. I wrote it so that other people can understand it and benefit from it as well.
And I assume that all of your books that people can find at your website?
I believe yes, they can.
A link to them, yeah.
Yeah, there's a link there for them. This one, have we got a few minutes?
Yeah, we'll need to wrap up here in about the next 10 minutes or so, but yeah, absolutely.
There's a huge correlation between oral health, dental care, and Alzheimer's disease. Of course, America are pretty much more advanced in dental care than the UK. And everybody has that little laugh, don't they? They all have this little joke about, dental care in the UK.
Right.
So my publishers, Jessica Kingsley, said we have a massive crisis here with poor oral hygiene and dental care. So they commissioned me to write this book, which is a long-winded title, but I didn't give it the title, it was them. It's the Pocket Guide to Mouth and Dental Hygiene in Dementia Care. guidance for maintaining good oral health. In here, I've done some case studies. So this is for caregivers. This is for caregivers, nurses, doctors, dentists, anybody who's supporting somebody living with dementia, whether it's at home or in a memory care community or a nursing home or wherever it might be. This is your Bible. And there are some really good case studies and some good examples of how we manage to deal with people who are resistant to oral hygiene and dental care, people who don't want to brush their teeth, people who are, resistant to those kind of things. We really need to get a grip of this dental situation here, this oral care, because as I said, there is a correlation between poor oral hygiene and Alzheimer's disease. So we really need to think about that as being one of the preventative measures as part of our nutrition, diet, and lifestyle. That really needs to be in the lifestyle pile to make sure that people brush their teeth. And mouthwash is really cool as well. And if people who take MCT, which I'm recommending, and look at Mary Newport's stuff for this, some dentists will suggest that you rinse your mouth out with MCT. So rinse your mouth out with the coconut oil before you swallow it, or rinse it out and spit it out. It can even help fill cavities and things like that. So coconut oil is a magical thing. Coconut oil and blueberries. And just one more thing about prevention.
Yeah.
There's a neurologist, very well-known neurologist called Morwen Sabar, who worked for Banner and then went to Barrow and who was now buggered off to Vegas. But he wrote a book with a really well-known chef here. The chef's name, I don't know. But it's called the Alzheimer's Prevention Cookbook.
Oh.
And I would suggest everybody gets that and starts looking at those recipes and eating from that thing, because one of Morwen's things was about brain health and brain foods, and he's not a coconut fan, but he really does push blueberries and the impact that blueberries have, because they're very high in antioxidants. So blueberries and turmeric. Introduce turmeric into your diet, because turmeric is an anti-inflammatory for the brain. So those things.
Wow,
but yeah, get that book, Morwen Sabar.
Yeah, a lot of good stuff there. I did want to say something you mentioned too. Qualifications and experience and training varies widely in hypnosis. In some areas, it's completely not regulated. I really do recommend that you reach out to someone like Dr. Dan, who, he can either work with you directly or he can refer you to someone. I get this all the time. How do I know if someone's a good hypnotist? Really, it's tough. I highly recommend that you look for someone who's got some experience with this. It's such a crucial thing. I don't think you want to take a chance with it with your uncle's friend who happens to do hypnosis on the side or something.
Yeah.
Right.
Yeah, absolutely.
And we see that a lot. We see that a lot in our business. And I'll tell you, whenever somebody comes to me and says, well, I had hypnosis before and it didn't work. When you ask them, well, tell me about the person you hypnotized with, so often it's, well, my friend was learning hypnosis, or, I didn't feel comfortable with them when I walked in, but I went, there's all these things. And hypnosis is such a big field, and I don't know. It's just really go to somebody that you can respect. And I highly recommend Dr. Dan.
Yeah. And if on the Nightingale Dementia Consultants website, are the Nightingale Dementia Consultants, who don't just work with dementia, they work with other clients as well, and they're very experienced and very well trained, because they're the only people that become NDCs. They have to go through my diploma for one to get on there. So, and people like Roger Moore, people like Jim. Jim, you've been around for quite a while. Jim's been around for ever since I've known you for
5 months.
Years. Yeah, 4 or 5 months.
Yeah.
Well, I think he learned a lot. He came to see me perform at the Tempe Improv once, and I think he learned a lot from that.
I did. That was really my breakthrough moment when it was like the angels came out.
That's
You know,
right.
and I recognize many of the names that you've mentioned. These are high quality people that I respect in the industry. I wanted to mention something too, and we've had this conversation before. And stage hypnotists, especially the people that just do stage hypnosis, they oftentimes will kind of there's this bashing of heads between the stage hypnotist and the hypnotherapist because, and I do agree somewhat that the hypnotherapy gets a bad rap and a bad reputation from what happens on a comedy hypnosis stage or street hypnosis. The other flip side is that it introduces more people to hypnosis. So there's good and bad. But what I want to tell you, because this is what happens a lot of times, people will say to me things like, I don't want to give up control. Here's the thing. Every single person that has ever been on my stage or that I've worked with doing street hypnosis or demonstration volunteered. I'm not making anyone do anything that they are morally opposed to or anything like that. There's an expectation when somebody volunteers to come on my stage or to get hypnotized in street hypnosis, there's an expectation they know they're going to be compelled to do things that are funny, that are silly. And I'm sure you've gotten this before, Doc. When somebody will ask me, come to me for, I want to quit smoking. Are you going to make me bark like a dog? And I tell them straight up, if I thought it would help you to stop smoking, hell yes, I'd make you bark like a dog. But I don't think it would. So no.
Yeah.
So I know you get that too.
Yeah, I got it I had a new referral from Barrow the other day, and I was doing telemed with that patient and her family. And that was a question that I was asked. Are you going to make me run around like, well, what did she say? Oh, you're going to make me act like a turkey or a chicken or something, do chicken noises. If you want, you can.
Sure.
It's going to help. Yeah.
And the other thing too is if you're doing hypnotherapy, you come to Dr. Dan for some help with your Alzheimer's or something. If he tells you to bark like a dog during your session, that little observer is going to say, that's not congruent with what we're doing. It's most likely going to go, no, I'm not doing that. So you have to worry about it.
That's his job, isn't it? That's what the critical factors are for. Yeah.
Exactly. The other, and we're gonna wrap it up real quick because I know Dr. Dan he's got a soccer game to watch. Or
That's right. Yeah.
They
kick off in 7 minutes.
Oh Lord. Okay, we got to wrap it up quick. The other thing too, if you've ever, because I get this too. Well, I watched this clip of you doing the stage hypnosis, and I know hypnosis won't work on me because I would never jump around, dance around, do that. Perfect. You're not that person. You're not the person that volunteers for the stage. People are mistaking. They misunderstand that hypnosis. I like to think of it as a Swiss Army knife. And with that Swiss Army knife, you've got a whole bunch of different tools. Once I know how to use this tool, this Swiss Army knife, I can do hypnotherapy with it. I can do stage hypnosis with it. There's so many options, and you don't have to be able, because I don't let go like that either. I've been on stage and I didn't like it. I didn't want to I didn't want to volunteer, but unfortunately, it was a friend of mine who dragged me up there, and I don't want to dance around unless I'm in control. So I get that. Really, you're not that candidate. You probably can't do the stage stuff, but you can still be a great client for hypnotherapy.
Yeah, absolutely. And one of the things that hypnotherapy can do is with anybody, but certainly with patients who have dementia, is uncover the hidden trauma that is leading to that anxiety that is fueling the dementia. Because a lot of people have got that trauma that they've lived with all their life and have never addressed it. And now it's impacting really deeply as part of the dementia and as part of the behavioral and psychological symptoms of dementia. So I think that being able to uncover that trauma and deal with it is a really important aspect of it. I have a patient who lives in a memory care community here in Mesa, and I've worked with him doing that. And we uncovered something that has really made a massive, massive difference, made a huge difference to him and to his family as well. So, yeah, absolutely. It's very powerful, very, very powerful.
It really is. And you know what I say is, I mean, it's with something as important as this. I mean, losing your identity, you're literally your identity. My mom one time told me, she goes, sometimes I don't know who I am. And she started crying. I mean, it's so important. Why wouldn't you try every single option available? Put your superstitions aside, your myths aside, all this BS. Please contact Dr. Dan. Find him at his website, nightingale.dementiaconsultants.com. Either you can work with him, he can refer you to someone else. Please do that. And if you're led to this kind of work, if you're passionate and you want to help people, you heard Roger Moore, Barrow. I know these people. They're well respected in the industry. If you want to, follow in their footsteps and become, someone who's a recognized expert in this, you've got trainings coming up sometime soon. When can people train with you?
Yeah, I only train 10 people a year. That's it. Okay. So these people graduate in December, and then the next intake, it's open now for the next intake. There are 7 places left. And if people book on there before or by January the 1st, they'll get the early bird rate, which
Excellent.
is, it's only, I don't know, £1,000 or $1,300, whatever, whether they're in the UK or wherever they are. But that's the early bird rate, and it's a very good program. And as I said, Beryl Comer, she's about to graduate in December. She's one of the people that will graduate in December from my program. So there's only once a year. It starts in February. February the 1st is when the course starts. It'll run throughout the year, but there's only that intake. Once I start that course, that's it. The thing's closed. I don't, people can't join it in March or April or May. They have to start in February when the course starts.
Yeah, and one of my passions is helping new hypnotists. And so if you're watching this in the Launch Your Hypnosis Career Now, if you don't know where to go, you don't know where to start, find a niche. That was my biggest mistake, is not finding a niche. I tried to help everybody. Focus on one group at first. And as he said, he's going to help you with the marketing and the paperwork, all this kind of stuff too, which, boy, for a new hypnotist, this is invaluable. $1,000, or $1,300, that's nothing. Few clients is going to easily cover that. Plus, it's going to upgrade your status in the field. So really, a lot of great reasons to work with this guy. This guy, really, really valuable stuff you're doing, Dr. Dan. Thank you for the work you're doing. Really. Thank
you, Jim. It's good to know you.
You too. And I wish I could have convinced my mom to come and get some work with you or something. It was, that denial is such a huge problem. And please.
It is. We just dealt, Lynn and I have just dealt with a case this week or last week where denial is the predominant thing, the denial. And I think, again, it's the fear and anxiety.
Yeah.
Because something's happening to you and you're not too sure what it is. And you've heard all about these, your grandma died from dementia and it was a bad time. Because, we didn't have any help. We didn't do anything. Nobody, there was nothing to help people. People were shoved in a nursing home or a back ward of a hospital, and that was it. Whereas it's totally different. We have so much we can do to help people. So being able to embrace it and say, you know what, I've got a memory problem, but I can do something about it.
Absolutely.
There is help out there. There are people out there that can help me. So that message needs to be driven home to every person that is diagnosed with a form of dementia. And we just recently discovered a new one as well, a new dementia that is called, it has the acronym of LATE, late. It's a long-winded dementia, but let me try and summarize this really quickly. It affects people who are over the age of 80, and we thought it would be Alzheimer's disease, but we were always confused because there was too many anomalies to suggest that it was Alzheimer's disease. So now, following the research and the MRI scans and the brain scans that have become so complex and fantastic now, where we can see changes in the brain, been able to demonstrate that it isn't actually Alzheimer's disease, it's late. And no matter what age a person is, it is never too late to begin hypnotherapy. It's never too late, you know, because
love that.
The research that I did was people who scored between 1 and 4 on what we call the global deterioration scale. That was the research. In clinical practice, I've worked with people who are, you know, very close to end of life with dementia. So it's never too late. And it's never too late to work with somebody who has progressive dementia either. Always have a go. Always see what happens. Never say no.
Well, and one thing, before we close off, one thing I would like to add too, I'm sure, I don't know where you stand on this, but I would say, you know, when he says have a go, that doesn't mean go talk to him one time, get hypnotized one time, because a lot of times people want to, I just want to give it a try, see if it works. It's not like that. That's like, really, you need to commit to the treatment plan that the doctor puts, whether it's 3 sessions, 6 sessions, whatever, to really get a good idea if it's going to have an impact. What are your thoughts on that, Dr. Dan?
Absolutely, Jim. I never, ever do hypnotherapy with anybody on their first consultation. Ever. Yeah. It's all about building trust. It's all about education, learning about your disease for one, learning about hypnotherapy and how that impacts on you and how it can positively help you, identifying what your actual challenge is and how we're going to work with that. So my first consultation always starts with some comedic experience. So, because people are very anxious, they're very afraid. So I always say to them, tell me the funniest joke, you know, or the funniest story you've heard this week, or the funniest thing you've seen on TV, or whatever it is, just to get a belly laugh going. If we can get a belly laugh going, that anxiety, it's melted away, it's gone. And you start building your trust, and you start building that therapeutic alliance, which is absolutely necessary. So sometimes even the second or third time, there's no hypnotherapy. You know when the time's right, but it is never the first consult, never.
And be willing to commit to some treatment if you need it. So I just want to remind everyone, Dr. Dan's website, Nightingale DementiaConsultants.com. If you want to talk to them about, you've got a loved one yourself that needs some help. Also, if this is the kind of work that you're drawn to, I know we had somebody comment earlier that this is the kind of work that they want to do in my group. Please reach out to Dr. Dan and get qualified. If you'd like to try hypnosis, you can check out my YouTube channel, of course. There's also a link you can grab a free hypnosis download just for relaxation. JimKellnerHypnotist.com/free-hypnosis. If you're watching right now or later, please like, comment, share, and subscribe to get more tips on how to use your brain more effectively. Dr. Dan, thank you so much for helping us out today.
Thank you, Jim. I'm going to rush off now because the game's started.
All right. Thanks a lot for that. Take care. Be well. Be awesome.